Kylie Maurer. I'm a physician assistant with UnityPoint Clinic Family Medicine. I mostly practice in Lorenz, and one day a week I practice in Pocahontas. I have been with UnityPoint for 6 years now. I've always had an interest in medicine. I have a lot of family members with very weird and complex medical issues, so I've kind of been around it my whole life. That kind of sparked my interest, and then at my undergrad at Buena Vista University, we had to choose to do an internship, and I was looking around at my different options and found physician assistant and just really liked what they were able to do and the flexibility and where we could go, how we could practice. My advisor got me set up with some local physician assistants who I shadowed with, and I fell in love. As part of PA schooling, my last year was all out hands-on doing different rotations. I was actually lucky enough to do one of my family practice rotations here in Pocahontas. I got established here, and then when I was in my last few months, they had reached out and said, hey, we have an opening. Would you like to join us? This is actually my dream job. I was really looking forward to this. I grew up in Lorenz, so this is back home for me. My typical day is never typical. There's nothing routine about it. It may start at 6 a.m. rounding on patients here at the Pocahontas Hospital and then heading back to start seeing clinic patients by 8 o'clock over in Lorenz. Sometimes I spend my lunch hours coming over to the hospital and seeing patients. I will also take care of our nursing home residents at the Lorenz Care Center. So I may have to bop down there over lunch or spend my morning over there, and it will be nothing for me to see a child, their parent, their grandparents, and even their great-grandparents in the same day at times. I approach a patient by trying to find common ground. So I try to find what are their interests, what do they like, what's going to work for them, what are they going to be successful doing? How are they going to be successful with their treatment plan? If something is not going to work with their work schedule, let's find something that is. I want them to play a major role so they feel like they are taking care of themselves and it's not just me telling them what to do. My favorite part about it being a PA is the flexibility that I have. I trained in 11 different areas, so I trained with our local cardiologists, our local orthopedics, our local surgeons, our local family medicine. I got to know all of them. So now that I'm practicing in the area, I've already built those relationships with those specialists, which has been really neat. I am married for 6 years to my husband, Kevin. We have 2 daughters that keep us very busy. Our Brooke is 2.5, and my youngest daughter, Paige, is 9 months. They are wonderful, and when I am not taking care of them, I like to golf. I actually played golf in college, and so it's been a great hobby that I get to keep up on. UnityPoint Clinic I enjoy because of all of the opportunities available. With it being such a large system, we have so many specialists available to us. We have so much support. We have so many resources, not just locally, but then we get to do it in the bigger areas and bigger cities as well.